Good evening. We're here at another webinar, Lamore Chiropractic. I'm Dr. Lamore. You all have heard many good things, I hope, about my chiropractic, but I want to introduce you to the thought of acupuncture. Acupuncture and chiropractic are sisters. They both work on energy. And when I started acupuncture, it was after becoming a nurse. And I'm going to back up a moment and say that in the early 80s, when I graduated from high school, I wanted to be in the Navy. That was my goal, going to college, becoming a naval officer, and having an outstanding career in the United States military. Unfortunately, during my college career, I ended up getting diagnosed with cancer. And it put me in a different direction. And the one thing that I'm blessed about is a friend of mine who's becoming a chiropractor introduced the thought of chiropractic. And she said, you know, why don't you try to do something different? And everybody told me in modern medicine that the only way to do it was radiation chemotherapy and hope for the best. Nobody had the thought of opening a door, a window to an opportunity that was out there that I could try to make myself better. And so this webinar is designed to introduce you to the concept of the philosophy of acupuncture. It's a beautiful therapy. It's an old therapy. In my ideas, it's probably the most traditional form of healthcare. It combines Eastern and Western because it does manual energetics and chemistry. And again, if it's done well, I've seen procedures where people have operations and just use acupuncture for pain control. And in our office, when somebody who wants a baby with infertility issue comes in and after a dozen or 24 treatments ends up with a baby, that's fantastic. Something that modern medicine couldn't give them, that traditional medicines and working with their body performed. So when I got involved with alternative therapies in terms of my care, in terms of chiropractic, I went on this journey and decided, wow, this is fantastic. And then as I developed as a practitioner and my life changed a little bit, I had a life experience where I had to change careers and I became a nurse. People think that I was a nurse before being a chiropractor, and actually it was the other way around. I was a chiropractor before being a nurse. I was a doctor for 7 years before I became a nurse. And I learned that understanding how the body works and changing and getting introduced to new therapies can change my body and open up my mind and make me healthier. And that's the goal here. When we look at traditional medicine, you'll read about the basics of it, where it comes from and why it works. But acupuncture is a principle, not a technique. One of the things that I try to teach people is that that acupuncture is a system of integrative medicine that includes both Eastern and Western, but it's just not needles. Everybody thinks acupuncture is just needles. No, acupuncture works on the body in a manual form, tuina or massage, energetic form, either cupping or moxa or needles or acupressure. And then the chemistry part, Chinese herbs, or even just nutrition, just the idea of hydration. Most people walking around that are older are protein deficient and dehydrated. So using acupuncture as a principle and understanding what we can gain from it, that's what we're here to try to educate you with and open up your mind to how the body can work with a little bit of aid, traditional aid, in terms of energy and nutrition and manual things to make it heal and work better. So when we talk about traditional Chinese medicine, what are we describing? We're describing something that was developed way back in the day, passed on father to son. And here at Lamore Chiropractic, we are based in traditional Chinese medicine, but we focus on the modern aspects of it. Here we use a graph. We use a graph to diagnose, where in traditional Chinese medicine, you'd go see the practitioner, he'd take the history, he would maybe do pulse and tongue diagnosis, and he would talk about these meridians, these roads or avenues of energy that the body works on, how it communicates from your eyebrows all the way to your toes. And these meridians, there are 12 of them. They're named where they go, where they come from. And we can use these meridians and balance these meridians so that we get the optimal health. The energy or life force that we talk about in acupuncture is called qi. The Americans will spell it CHEE, or life energy. The Chinese will be, QI, meaning the force, the life force in your body that directs it. And it's not just manual, it's energetic, it's spiritual. You can't separate the body in specific little ways. It's all one jumbled mess. And we want that jumbled mess to be balanced and harmonious. That's the true expression of health. So when we're talking about going to the acupuncture and opening up this realm, you're going to go there, and it's going to be concerning because a lot of people are worried about, the needles, or about, exposing an area of their body. But a good practitioner will put your mind to rest. Here, we'll have you come in shorts. We'll give you a top if we have to expose a body part. We want you to be comfortable. The whole idea is to de-stress the body, get this harmonious situation in control so that you have the best life expression of the chi, or the body's energy possible. And what we're going to do is we're going to take a history, just like we did in chiropractic. We're going to find out where you have your blockages, where you have your instabilities. What do you think is wrong? We're going to base it on findings. This is where the traditional Chinese doctor would do a pulse and tongue diagnosis. He would hold your wrists and your ankles, meditate for 15 or 20 minutes on a red pillow, and say your gallbladder's out. Here at Lamar Chiropractic, we go a little further. We do a Japanese style and a traditional Chinese method. We use a graph. Just like you go to the doctor and you get an electrocardiogram, check out the level of the energy of the heart. We're going to use a probe and measure the amount of electricity at the acupuncture point. It's been done since the 20s. It's been reproduced from practitioner to practitioner. It's admissible in court. And I think it's the most modern, productive way of determining where your instability is. Again, we're measuring the amount of electricity at the acupuncture point along with your history to make the determination where to treat. So when you come in and we do our examination, it's fairly easy. The graph doesn't hurt. It's just an electric probe. It produces a graph with the 12 meridians. All the acupuncturists use the same meridians to treat off of. It produces a graph where we look for the basic level of homeostasis. That's the green line. And then above and below, the standard deviations of allowances. You're going to see a red line, which is hyper or hot. That's too much heat or too much energy. And hypo is going to be too low. We try to balance this. So when you come in and you get a graph, we're looking for a basic level in this graph of homeostasis or balance. And you'll see a printout where all the meridians are there and how off they are. Based on your presentation, your history, your evaluation mechanically from me, and your graph, that's how we treat. And typically we use needles, but again, acupuncture is a principle, not a technique. We could use needles, we can use electricity, we can use a teishin, which is a mechanical form of stimulating the point. We can use pressure, we can use a chemical. We can use seeds. These are little beads or needles that on a Band-Aid that you use to stimulate the acupuncture point. What we're trying to do is determine where your balance is and how can we improve it to give you the optimal function of health. That's the whole goal. Remember, and introducing you to something you might not have think of. You know, you in this time of viruses and stress and schools and work, just coming in to get an assessment to see where your stress level is could be a benefit. And using some information from an acupuncture graph to do some homework in terms of manual acupressure. Your spouse, you could say, okay, my kidney point is low, and your spouse could come home and work on kidney point. Everything we teach you is based on findings. We want to teach you and educate you based on your findings on your body, as well as the graph on how to have the best health. Know before you go. The whole thing is information. We're here to teach you. I want you to be the optimal health possible. I don't believe that as we age, we have to break down. I don't believe that a size or a function is important. I want you to be the best you can be. That's what acupuncture works on. And then teach you what you need to do to help yourself. Remember the three things: 0 to 20, you grow; 20 to 30, you mature; 30 on, you start to change. Just like mechanical things in acupuncture, you're going to do different things at different points and reassess all the time. So when you're going, we want you to be relaxed. I want you to be comfortable, and I want you to just communicate where you are, what the symptom is, and let me educate you on how you can improve these symptoms. Acupuncture is not scary. It's traditional. Ultrasound. Ultrasound, physical therapists use. They do that. It's a mechanical form of energy. They're doing acupuncture. You come to me as a chiropractic patient, we do ultrasound all the time. You're getting acupuncture. You don't even realize it. So just being prepared, just being relaxed and communicating, that's the thing. For me, I want you to come the way you are. I don't believe that you should do anything beforehand. I want you to be who you are so that we can see where you're at that time. And then as we treat you and you improve, you go, oh, I'm better. I shouldn't be here. I got to be over there. And we talk about, again, with acupuncture, a mechanical aspect to it, a chemical aspect to it, and an energetic standpoint. If you're not sleeping and your battery's running low, with acupuncture, we might add some electric stim to that to charge the battery. And again, with the graph, this way of treating acupuncture, we're going to reevaluate you every 6 to 12 visits to see where you are. Base the information of your treatment on your findings as well as your presentation. Is traditional pulse and tongue diagnosis better? No. Is it different? Yes. I just can't, as a nurse, say that I could feel a pulse and determine what that pulse would be on the short history of my experience with acupuncture. If my dad was an acupuncturist and I started it when I was a young fella and learned from father to son like a craftsman, I could be darn good. A lot of these guys from China are phenomenal. I mean, they're doing work way above my level. But again, it's going to the practitioner, talking to the practitioner and seeing their style. I'm very comfortable in doing a graph and treating you. With 30 years of experience and 20 years of experience in acupuncture, I'm very confident. And the results are phenomenal. You know, when we talk about expectations, I always tell people they'll come in and they say they want acupuncture, especially if they come in and they're a cancer person. I mean, haven't had cancer myself, there's some affinity there. But I always tell them, I don't have halos and wings. Miracles aren't happening. What I'm going to do is educate you and treat your body, and based on your findings, you can expect to get better. One of the best things that ever happened is again, I told you I worked as a nurse, I worked at a naval hospital, and I actually had a patient who came from the naval hospital who had stage 4 kidney cancer. And this is all documented. She comes in and didn't want chiropractic. Matter of fact, I don't think she likes chiropractors at all, but she's tolerating me because she knows I'm a nurse and she knows I do acupuncture. She had stage 4 cancer in her kidney. They have it all documented on MRI and CAT scans. This procedure was done at the Naval Hospital. So she did chiropractic a little bit because I kind of elbowed her a little doing chiropractic because that's a manual part of acupuncture. We did needle acupuncture and she did visualization at home. We did 3 months of care. She has the documentation. The tumors actually shrunk. The surgeon went in. He didn't have to remove the kidney. They scooped out the tumor, brought the kidney back online. He never saw anything like, in 35 years of surgical experience, never saw anything like that. And she healed beautifully. To this day, she's not had a recurrence of anything. If she hadn't tried acupuncture, where would she have been? Maybe minus a kidney. And the physician was like, what did you do? Was it the acupuncture? Was it the visualization? Was it God? Who knows? Who cares? She tried something different and expected to get a better outcome, and she got it. And she's older and happy, still doing well. So the expectation is that you have to try. You have to know who you are. You have to know where your body is and expect to be as vital as possible. Not as you age, you get older and infirm. That's ridiculous. I think the idea is that you have to be open-minded and try things and talk to your practitioners, medical doctors, chiropractors. Heck, I mean, I've got 2 cardiologists, 5 primary care physicians, 3 chiropractors. I mean, I do everything. And a wife who's concerned makes me do all of it. The idea is to keep trying. You know, when I see a new patient with acupuncture, the biggest thing I say to them is that you might have some endorphins and enkephalins, some chemistries, just like you ran a marathon, dumped into your body. So you can be a little fatigued. There are other concerns in terms of a rash, or some people worry about fever. Here at Lamar Chiropractic and most practitioners of acupuncture all use single-use disposable needles. They're going to use a little bit of alcohol before they do the procedure to clean the skin as preparatory. They're going to use the needle and they're going to throw them away. If they're not using single-use disposable needles, run. I don't see that anymore. In China, they do. Sometimes I hear. But in America, we all use single-use disposable needles. So the risk of an infection or complications of acupuncture from a licensed and certified acupuncturist are very low. There is a risk in some instances, depending on how the person was needled. If you're doing in the mid-back, you could have a lung issue. They can puncture a lung. But again, a seasoned, well-versed acupuncturist is going to be very protective of the patient. Here at Lamar Chiropractic, patient care is primary. We never risk anyone's health. We want you informed. I want you knowing exactly what we're doing, how we're doing it. Yes? So that you feel confident in knowing that if you have a question, anytime you can call or email me, that you know that your care is going to be the best out there. You can go to someone else and it might be a little different. I don't think you'll find better. And I think combining acupuncture and chiropractic and modern medicine, all of these things together, like the lady with the kidney cancer, your outcomes should be phenomenal, not sitting there aging and feeling infirmed. You may feel a little worse before you get better. Same thing with exercise, right? You go to the gym and you first start and you feel sore and achy and you can't walk. If you talk to the athlete who exercises, they go, I just did a 100-mile run or a 50-mile run. I have a couple of high runners, long distance runners, and they go, I did okay. Because their body is well tuned. It's better in shape. They're more conscious of it. And that's what we want you to do. We want you to understand that when you first come in, if you're in the disease process, you may have some results that, oh my gosh, I feel like these endorphins and enkephalins are kicking my butt. That will pass. And as you educate yourself and as you get better with the acupuncture and your body becomes harmonious and more in balance and your energy raises, you feel better. It shouldn't feel like it's a big process. It shouldn't feel overwhelming. Acupuncture is so wonderful. It's one of the best stress reducers out there. We talk about what is a treat. My thing is that you don't treat conditions, you treat the person. That's the biggest thing. You know, I was talking to a lady, she comes in for chiropractic. We do ultrasound. That's acupuncture. She doesn't realize it that we're treating bladder meridian because she has spinal issues. She's older. She's heavier than she wants to be. And I say to her that I think she's healthy. I think she's doing fine. We do a graph. We do blood work. We do x-rays. We do vascular studies. And the findings show that she doesn't have any instabilities. So at 52 years old, yes, her muscles are achy. She has the skeletal part that's normal, but the neuromuscular part is chronically irritated because of today's society. Nutrition could be a little better, chronic positioning in terms of stress, sitting at the computer too long. But in terms of diseases, she's not doing bad. I told her, I said, you can't get arthritis at 52 to make you hurt when you don't have it. Even if she started today, she still couldn't develop as much arthritis today to hurt her because she's not arthritic. She's healthier, even though her size may be different and her expectations are different. So I treat the person. Again, the idea is that acupuncture can treat all the list of diseases you see, but don't focus on the disease. Focus on your body's function. How am I functioning? Am I 52 years old and still being able to work a 12-hour day? or run a marathon? Or am I sitting there and in front of a computer in chronic pain? Yes, we can specifically use needle acupuncture or acupressure to treat chronic pain and neuromusculoskeletal conditions, a tight muscle, a bent spine. But I want you to understand, not only are we going to treat the symptom, but we want to treat the individual. And I want you to know as much as about your body as possible. Again, the idea is balance. Okay, your body's vital energy. Okay, so the idea of this chi, I think it's wonderful. I think that, again, when we talk about acupuncture, you can't separate the mechanical, the chemical, and the spiritual or the energetic. You have to have all three. You have to have all of these things to produce the best energy possible. You could be missing an arm or a leg and still be 100%. You're not 100% mechanically, but your body's life force is, and doesn't mean you're going to live any less of a life or any less vital of a life. So when we do a graph and we look at the body's energy, and you see people with a low graph or balance, or infirmed and sick, and their sleeping is poor. If we change what we do in terms of nutrition or hydration or supplementation, a little bit of vitamin D could do wonders. And the graph can show you this. And then we teach you at home what to do in terms of acupuncture points. One of the things in old-fashioned Virginia medicine, when a child was sick, a mom would take an onion, slice it, put it on the bottom of the foot, put a sock on it. That's kidney 1. That's bubbling spring. That there is an anti-inflammatory point. They didn't know they were doing acupressure or acupuncture as a principle, but that's what we're doing. They were breaking their child's fever by using an onion. That chemical reaction on the acupuncture point made the change in the body and balanced the energy. So when we're talking about the chi, we'll find out from the graph in your presentation where your energy level is low, give you the homework for acupressure that you or your spouse can do, or you can do a foam roller or the stick, anything to move that energy and keep it high. Add some supplementation or some nutritional changes so that you have the best expression of vital energy possible. Again, my goal here is education. I want you to use this as a resource. You can go back as many times as you want. That's the whole goal of this. The goal is to introduce to you something that you might not think you need that could be beneficial. Who doesn't have stress? Any type of stress. I mean, the idea if you came in 4 times a year and said to an acupuncturist, hey, I just want you to do some acupuncture to see what happens on my body. There's a positive effect. You know, people come in and they go, I had acupuncture and I didn't feel anything. And I'm like, so what? People take birth control, don't feel anything. It still works. But just because you don't feel it don't mean a hoot. The idea is, what are you doing to get healthier? You're doing acupuncture, you're going to get some change in your body. You might not feel it at that moment, but if you have a plan by using acupuncture, chiropractic, modern medicine, supplementation, exercise, all of these are going to build on each other. And then when you're in your 50s, 60s, 70s, 80s, and 90s, you're not going to have the adversity that other people have. And they're going to go, what'd you do? And you're going, I went to the chiropractor. What else? I went to see the acupuncturist. Well, what did it feel like? I don't know. It just felt like nothing. He just stuck needles in me and I got better. Because the body knows what it needs. We just here, we try to put a modern slice on it. Just like they check brain waves and they check cardiovascular function with electrocardiogram, we use the graph. I want to be as specific as possible. You could come in, get the graph, and go to another acupuncturist. He's going to know what that says. And then you can compare. Again, it's education on your body. Your body is the doctor. That's the real doctor. It just needs some ways of reducing the irritation and get that balance that you deserve. So when we do the acupuncture, you'll see on the videos, it's really easy. Most of the patients come in, they'll come in with shorts, or they'll come in, we'll give them a top. And we might use a half a dozen needles at a time. We always use alcohol preps. And so you'll see Christine on the video insert the needles, and you'll see certain patterns. Again, the idea is for me, I want you to come in the way you're coming in. There's no right way to come in. You come in and let the body do what it wants. My kids were tortured when they were young, and they know what TV antennas are in the aluminum foil and a coat hanger, because that's how we had our television. We're trying to tune in the energy of your body with these TV antennas. They look silly sometimes, and sometimes it's a little bitey. You'll feel, they call da chi, but for the most part, 90% of most patients don't even feel it. You'll see also sometimes that when I pull out a needle, you'll see a little bit of blood. They call that the da chi, or the moment where the chi is changing. That's a good sign. It's self-healing. Sometimes you get a little bruise, but complications from acupuncture, needle acupuncture, are very low. And then we send you home with sometimes a seed in your ear or a press pin, and we give you the homework and we teach you the points that you need to do, along with the nutritional changes, along with the exercise and the stretching, all of those. That's acupuncture. It's a principle, not a technique. Again, understand that you want the body to be balanced. And as we learn and you learn to communicate better with me, your primary care physician, your cardiologist, all of us, that's the real benefit of healthcare. That's healthcare, not crisis intervention. So again, when we're talking about acupuncture, it's a mechanical, a chemical, and an energetic type of modality. All of these things come together. You'll see when I talk in my chiropractic realm, we'll talk about the mechanical, chemical, and surgical in terms of doctors. Well, acupuncture kind of covers everything. Again, because we're so specific in terms of our modalities, in terms of our professions. Medical doctors only do chemistry. Chiropractors only do mechanical. Acupuncturists only do energetics. And trust me, one needle in your knee is not acupuncture. If that acupuncturist isn't talking mechanical and chemical as well, that is not acupuncture. That's why I love the idea of a chiropractor doing acupuncture, because they're sisters. We're already working with nerve energy. We're already the nerve doctors. We're already the mechanical doctors. We need the chemical ones too. Thank God we have them. In crisis intervention, I'm going to the ER. I'm not going to go to my office. But we can also use other modalities to enrich our lives and not have the expectation that it's all doom and gloom. Trust me, when I was young and the steam came out of my life in terms of being diagnosed, my prognosis was less than 5 years. If I had listened to him and not listened to the chiropractor, where would I have been? I might not have tried. And then learning about acupuncture from my wife, learning how to express the body in a better form. My first patient was flipping my daughter in utero when she was breech. I was hooked. It's not that I'm fascinated with medicine. I'm fascinated with results, and I see it. I wasn't educated in the realm of acupuncture. It opened up a whole new light, and I use it all the time. And I use it in different forms. Like I said, you come in, if I think the nerve energy is too low, I'm going to do ultrasound. I'm going to stimulate that mechanical energy into an energy into the nerve to give you the best results possible, as well as changing the body's posture and dynamics. Then we go back into that idea of what is acupuncture. I love electric acupuncture. You just use a probe. People say, I don't want a needle. Okay, we'll use electricity or laser. That's the new one. Laser works just as well. Again, the idea is you're stimulating the body to produce a change in that chi, that level of energy. And I like about with the graph is that it's objective. You can follow it, and you can take it to any acupuncturist. I love pulse and tongue diagnosis. I just am not proficient enough to feel confident enough to do it on somebody, so I wouldn't do it. I feel very proficient and understand the graph, the more medical approach, very about findings rather than feelings. Again, just because you don't feel it doesn't mean a hoot to me. No one feels osteoporosis. You get diagnosed from an x-ray, and you take calcium and pills that you don't even feel. Yet the results are there. You don't break bones in your 8th and 9th decade of life. So using acupuncture for electric stimulation to raise your chi, to tune your body, you're going to have the best expression of health as you go along. And again, with acupuncture, we're talking about the mechanical component. We're going to try to doctor and fix the expression of the body mechanically so that you can do whatever you want to do. 80s, 90s, 100. I met one fella. He rides a motorcycle at 90 years old. His wife worries and said to her, she worried just as much as at 40 as she does at 90. But he's confident in what his skill set. That's the kind of body that I want, one that I'm allowed to do whatever I want to do. I have limitations. Everybody does. Everybody has something. But using all of the modalities, using acupuncture, understanding that concept of the mechanical, chemical, and energetics, and using it as when you need it, or as you think you need it, and communicating with that physician, that's where you get the ultimate health. That's healthcare. That's not that crisis intervention junk. So again, this is just another graph, and you'll see the lady treated on the video, I checked it out. She does more acupressure, but we use electricity on the big pads for the big body parts, or we can clip the electricity onto the needle. Now, a traditional acupuncturist might burn moxa, and moxa is an herb that they use around the needle. They light it up, and usually you'll get a little bit of aluminum foil or something as a barrier, because as the herb burns, it produces an energy that's just like electricity. It's fantastic. But as the herb burns, it can fall and drop, and sometimes you'll see little scars on the skin. It's not uncommon, especially in the legs, that I'll have an Asian person come in and they'll have moxa burns. Caucasian people, Americans, they don't want to be burned at all. They'd rather use electricity. Understandable. The other thing with moxa is that it smells potent and pungent. So in my office, when we treat migraines and headaches, we don't use moxa. There's moxa that you can get that you don't burn. I don't think it's as effective. But again, understanding all of these types of acupuncture, that's important. Electric acupuncture, more my style, more therapeutic for me, whereas traditional acupuncture might use moxa. Again, same results, different way of getting there. And again, educating you about that. You can use acupuncture anywhere on the body. I limit myself. I'm going to do more neuromusculoskeletal. I'm going to do more vital energy rehabilitation. I like more for cognitive functioning, making sure the body works well in terms of nerves. A lot of OBGYNs will use it for vaginal issues or menopause. My thing here is that I like doing infertility. At this clinic, we have 6 children born with acupuncture that wouldn't have been born otherwise. The oldest gal that I had performed acupuncture on for infertility was 42. It took 6 visits, and she had a baby. The longest one, and her daughter right now is about 11. We're good friends. She was the first person I did infertility treatment on. It took a year. But again, late 30s. But again, if they hadn't tried acupuncture, they might not have gotten the results they wanted. Their results are the blessing of a child. My focus more is not on facial or cosmetic approaches. Mine is not always on OBGYN, which is fantastic with acupuncture. Mine more is internal and nerve. And again, educating you on the nerve function of the body, the energy level, so that when you're 70, 80, and 90, you're functioning at a higher level, not droopy and saying, I can't move because I'm hurting or infirmed. So again, when you think of that athlete, I have one man in who I adore. He's one of these marathon runners. He runs all the time. He's a fantastic young man. And he runs 100 miles or so, and he doesn't think anything of it. He kept me to run a city block, and I'm already exhausted. So the idea is that you have to understand how your body works and how acupuncture can help. Everybody has some instability. But again, the athlete is not going to feel the exercise as somebody like I do, who doesn't exercise on an ongoing basis. The idea is somebody who has acupuncture might feel a little bit out of tune in the beginning, where somebody who does it on a regular basis might not feel so out of tune. Again, your education is paramount. Understanding that acupuncture is a viable therapy today that is old, but is modern. Federal Blue Cross Blue Shield, thank God, they're one of the most progressive insurances out there. I think they give 24 acupuncture visits a year. I mean, to just throw that away is sad, because you can get so much benefit from it. Talking to the practitioner, whether he's a chiropractor or a medical doctor, and using all of the modalities, use everything you have to get the best expression and the least amount of medicine possible. If a couple of needles can do that, hey, I'm all about it. If you come in and you say, I don't like needles, then we're going to do laser. If you don't like the laser idea, we're going to do acupressure. Heck, I'll even give you the onion to cut to put in your sock at night if it got better for your arthritis. The idea is teaching you the principle, using the best principle for you, and communicating with me what you want. The expectations, in my eyes, high. And again, when I have somebody who comes in with infertility and is upset because they can't have a child, and we stick some needles in her and she has a baby, man, that rocks her world and makes me happy as a practitioner to know that these things are out there. We just have to communicate more with everybody. Let everybody know. Don't be afraid. Talk to your friends. Come in. Matter of fact, you know what? At this point in time, if you listen to this webinar at any time, you come in, I'll graph you. I'll do whatever it takes to show you what your body's expressing. That's how important it is. You can take that graph to any practitioner or anything, and I'll sit down and I'll explain. No charge, no nothing. You come in, we're going to do that graph, and we're going to take the time to show you what the value is in understanding that acupuncture can be part of your health program. So that when you're 70 and 80 and 90 years old, you're happy and healthy and not sitting there going, oh, I can't move. That's acupuncture. That's the idea of what we're trying to communicate here. So again, I think that acupuncture is the most traditional medicine out there. I think that as I learned, again, I went from modern medicine that gave me limits to a chiropractor who expanded my mind and gave me options and choices, to falling in love with acupuncture. That using acupuncture on an everyday basis. I practice acupuncture every day. People might not know it. I don't care. As long as they get the results and then I can communicate to them and they're getting better and I watch them get better and healthier, that's the goal here. That's what we want. We want you to understand that you can use all of these modalities to get the best health possible. And again, communicating with us, just know what type of acupuncture you're doing. Is the guy using a graph, or is he using pulse and tongue diagnosis? And where are your insufficiencies? And is he using mechanical, chemical, and energetics? Going to an acupuncturist, sticking 3 needles in your knee because knee pain is not acupuncture. I don't know what you call that. Dry needling, that's dry needling. That's not acupuncture. That's not the principle of acupuncture. That's just taking a needle and breaking up stuck muscles like an ice pick does with ice. Is it therapeutic? Absolutely. Is it highly therapeutic? Absolutely. Do physical therapists and chiropractors all use it? Yes. Is that the principle of acupuncture? No. You're not working on the energy, you're working on the muscle. Is it less important? No, but I tend to focus more on healing the body and getting the body's best expression with the elevation of chi as possible. That's why I think that acupuncture, manual medicine, and understanding about the chemistry is the best approach for wellness, not just crisis intervention. Here, finding an acupuncturist is real easy. You walk through the door. If you're concerned and you want more information, you walk through the door and say, hey, listen, I listened to your webinar. I want my graph. I'm going to give you the graph. No problem. And I'm going to sit down and explain to you what the heck I find. And I always tell people, when you come through the door, challenge me. I love being challenged. Again, I want to be the best chiropractor possible, the best acupuncturist possible for me. And I work hard at trying to do that. And I work hard to communicate healthcare to my patients and healthcare to everybody. I want everybody to be the least amount of medicine, the least amount of surgery, and the greatest expression of health. One of the ladies at the Legion still riding motorcycles, you know, I like that. I think she's wonderful. I think the idea of doing what you want at any age is the bomb. That's the real goal. That's the idea of understanding that I can use manual medicine, energetics, and chemistry to give me the best life possible with the least amount of effort. It really does. All you got to do is walk through the door. We do most of the work. So again, I want you to use me as a resource. This webinar was designed to give you an introduction to the idea of acupuncture. Acupuncture, my perspective, is a principle, not a technique. There's so many different styles. There's so many different styles of diagnostic, using an electric graph, a probe like an electrocardiogram, or doing old-fashioned pulse and tongue diagnosis. You can treat anything in the body. Just talk to your practitioner. You understand that you're going to use all of these modalities to get the best health possible. Side effects, if you're using needle, there are side effects. There can be the risk of a lung puncture or an infection. My experience, very low. Expectations of acupuncture, through the roof. From helping somebody with a cancer diagnosis in terms of making their body better so that they withstand the cancer, and also getting a baby that they never thought they'd get, or having an operation with just using acupuncture as pain control. Again, know your practitioner, know your body, know what you want, become educated. Because of this webinar, you come in, I'm going to do the graph, I'm going to educate you, you can walk through the door. The goal is your understanding of how acupuncture can benefit your life and add to your health care rather than crisis intervention. I hope this has been educational for everybody. I had a pleasure. It's the second one I've done. Any concerns or any questions you have, email me, come in. We'll do whatever it takes. There's more information on the webinar and in terms of where you can go for resources. Again, be bold, be aggressive, go out there, learn as much as you can, take advantage of all of the modalities out there. Just don't stop at the idea of just a pill. Again, I love medical doctors. They're my best friends. Thank God for them. If I'm in crisis, I'm going to the ER. But I also think we also should look at the other alternatives. Not alternative to healthcare, other alternative to practitioners, and understanding that life is about a salad, different modalities, different things in that salad to get the best healthcare possible. Thanks again and again. Come in for your free graph. If there's any concerns, just give me a ring. Talk to you soon.